Broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and welcome to the COVID-19 Information and Updates webinar. We're hosting this from the Children's Cardiomyopathy Foundation. My name is Gina Petty, and I'm the Director of Family Support and Outreach here at CCF. We'd like to extend a warm welcome to everyone on the webinar this evening, and we hope that you find it helpful and informative. Before I introduce you to our presenters, we have a few housekeeping items to review. In order to provide the highest quality webinar session and avoid background noises, all attendees are in listen-only mode during the presentation. If at any time you experience technical issues, you can type your concerns into the chat window on your control panel, which should be on the right-hand side of your screen. If you have any audio issues with connecting, you should be able to switch between using your computer audio with a call-in number. That is a choice on your control panel as well. Many have already submitted questions. Thank you. And if you have additional questions throughout the presentation, you can type them into your question box on the control panel, and we will go through as many questions as we can at the end of the presentation. If the control panel is preventing you from seeing the screen, you can hide it by clicking the small orange arrow at the top left of your control panel to minimize it. This is being recorded. The webinar is being recorded, and we will post it on our YouTube channel, CCF Heart Kids, and we'll also send out a link to everyone on the call with the link later on as well. So now I'd like to introduce you to our presenters tonight, Dr. Daphne Hsu and Dr. Margaret Aldrich. Dr. Hsu is Professor of Pediatrics at Albert Einstein College of Medicine and the Chief of Pediatric Cardiology and Co-Director of the Pediatric Heart Center at the Children's Hospital of Montefiore in New York City. She's one of the nation's leading experts in children's heart failure and heart transplant. Dr. Hsu is also a member of the Children's Cardiomyopathy Foundation's Medical Advisory Board. Dr. Margaret Aldrich is Assistant Professor of Pediatrics at the Albert Einstein College of Medicine and the Director of Pediatric Infection Control at the Children's Hospital. Thank you both so much for joining us tonight. On behalf of CCF and our community, I'd like to extend our gratitude for your sharing of your expertise. Thank you so much.
Thank you, Gina. And we are very happy to be here today. We know there's a lot of concern in the community, and we are here to give you some information about COVID and then hopefully answer some questions from the audience. So I thought I'll start by just giving an overview of COVID. I've developed this with Dr. Aldrich, who knows much more about the infectious disease component of COVID, but I've tried to put it into context of what families might be concerned about with children with cardiomyopathy. So we'll get started on the slides, and hopefully you can all see them. So first, we're talking about what is a coronavirus. COVID-19 is called COVID-19 because it's a coronavirus, and coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, which is called MERS, and severe acute respiratory syndrome, or SARS. I think we've both heard of those diseases in the recent past. The most recently discovered coronavirus, SARS-CoV-2, which is the scientific name for this, has now been named by the World Health Organization as the disease COVID-19. So first, I think the first idea is, how is coronavirus 19 spread? Well, it's spread primarily through respiratory droplets or discharge from the nose when an infected person coughs or sneezes. So there are a lot of different ways that diseases are spread. This one seems to be spread with direct contact with droplets of an infected person. These droplets can land on another person or the surface of an object around the infected person, and another person can become infected by inhaling the droplets or by touching a droplet on the surface of an object and then touching their eyes, nose, or mouth. Infection is spread through direct contact with the respiratory droplets. It's not spread through the air. So the spread is really the concern of whether or not the droplet reached you or reached something that you touched. It doesn't travel through the air for great distances. It doesn't persist on food, so cooked food is fine. Risk of catching disease from a person who is not coughing is quite low. And the risk of catching the disease from feces of an infected person also appears to be low, which is very important for our parents taking care of children in diapers. So how do we prevent infection and slow transmission? This is the concept of social distancing and social isolation. The first principle is you wash your hands regularly with soap and water, which is fine, or clean them with alcohol-based sanitizer. Soap and water is just as good as alcohol-based sanitizer. It certainly just isn't as convenient if you don't have a sink nearby. You are supposed to maintain at least 6 feet distance between you and anyone who's coughing or sneezing, because droplets really cannot travel more than 6 feet. It's really 3 feet, but 6 feet is the insurance, which is why we're asking everybody as much as possible to stay 6 feet away from anyone who's coughing or sneezing. Obviously, parents are not going to be able to stay 6 feet away from their children, but anyone else who you come in contact with, you should try to stay 6 feet away from them. People who are coughing or sneezing should cover their nose and mouth, and as we've said, as you've heard on the news, don't cough into your hands, because then your hands will then be touching other things. Try to cough into your sleeve or cough somewhere where that area is not going to touch a surface. If you feel unwell, if you have a fever, if you feel like you have a cold, if you're coughing, you should stay home so you don't expose other people in case you have acquired the coronavirus. And when you're out, you should socially distance yourself by staying at least 6 feet away from people, avoiding unnecessary travel, and staying away from large groups. What are the symptoms of COVID-19? Well, the symptoms are really very, they have a wide range of symptoms. It can range from a mild respiratory illness, and even some people not knowing they have it, to respiratory failure. The symptoms occur most commonly between 2 and 14 days after exposure. So that's 2 weeks after the exposure is really the limit of when you would develop the symptoms of this disease. And the common symptoms are fever, tiredness, and a dry cough, not a wet cough. Other symptoms can be shortness of breath. It's difficult to breathe. It's hard to speak because you have to breathe in between your words. You can have aches and pains, which people talk about, kind of flu-like illness, sore throat, cold-like symptoms, and vomiting and diarrhea are a little more common in children than they are in adults. So what should you do if you think you or your family member has the symptoms of coronavirus? So the first thing you should do is call your doctor to discuss. That could be your pediatrician, or if you have a child with cardiomyopathy, that could be your cardiomyopathy cardiologist. I think all the cardiologists are quite aware of this disease. Everyone has boned up on what to do and how to think about it. So calling your cardiologist would be a fine option, but also calling your pediatrician, who might know more about the resources within your area for how to care for patients with COVID. If you think you have the symptoms of coronavirus, think about the symptoms. The serious symptoms are trouble breathing, persistent pain or pressure in the chest because it's difficult to breathe, people who are confused or can't be aroused because they are really basically too ill, or bluish lips or face, which is a sign that the oxygen is not getting to the blood because of the lung disease. These symptoms are not common, but they're something that you're watching for in every patient you're concerned about who might have COVID. There is actually a coronavirus checker on the CDC website made for patients to see about their symptoms and to answer questions, and it gives you an answer about what they think you should do. It's certainly not a substitute for your doctor. And at the end of the presentation, I have the website that you can go to if you are concerned for you or your family member about whether or not these are serious symptoms of COVID. And if you think you might have the symptoms of COVID and COVID is appearing in your community, you do want to self-isolate yourself, which we'll talk about in a little bit. So who is at higher risk of complications of COVID-19? We've read this on the CDC website. I'm sure it's been a lot in the news. COVID-19 affects adults more than children. And when they look at those adults, they find out that adults who are 65 years or older, people who live in a nursing home or long-term care facility are all at risk for more serious COVID disease. Not at risk for getting the disease, not more commonly at risk for acquiring COVID, but more commonly at risk for getting the serious complications of COVID. The other high-risk conditions that appear out of the data from China and Italy include people with chronic lung disease, emphysema, chronic obstructive pulmonary disease called COPD, or moderate to severe asthma. People who've been admitted for asthma, require asthma medications every day. People who have serious heart conditions. These are really elderly people who have have had heart attacks, have valve problems, have had heart surgery. They seem to be at risk for having more serious illness when they get COVID. People who are immunocompromised, including cancer treatment. There's really very little about heart transplant patients. There were a few reports from China about heart transplant patients who quite honestly did not seem to be more affected, but maybe not only 90 patients in the report, so not really very helpful in terms of looking about the larger community of heart transplant patients. And persons of any age with severe obesity, that means your body mass index, which is calculated by your height and weight, over 40. Or certain conditions such as diabetes, renal failure, liver disease might also be at risk for worse complications from COVID. Unfortunately, or fortunately, nothing is known about how coronavirus affects children with chronic diseases, because there have been no reports of children with cardiomyopathies in the reports of the children who have been infected, mostly coming from China, because they had the disease first, so now they're able to look back on their population and talk about what happened to people. Now, what about testing? There's been a lot of questions about testing, a lot of discussion about testing in the community, in the news, and I think we have to think about testing in two different ways. One is, what is the benefit of testing for the patient, and what is benefit of the testing for the community? So for the patient, the benefit of testing a patient to see if you have COVID-19 is that you know you have COVID-19. What right now we're saying is if you have the symptoms of COVID-19, the flu is getting less and less prevalent in the community. If you have the symptoms we've just talked about, you should treat yourself as if you had it. That means you should self-isolate, and your family should take care to not come within 6 feet of you if possible, and to make sure if they have to wash their hands, keep as much as possible, keep surfaces clean. So that if you get tested and you are negative, it's helpful, because then you know, oh, I don't have it, or my child doesn't have it. That makes you feel that, oh, this is great. However, the COVID-19 test isn't perfect. So there are patients who test negative, who test positive later in the disease. So it doesn't tell you 100% if you don't have it, but it can be reassuring later on in the disease if you're not positive. So the benefits of testing for the patient are really not so much, because the symptoms are treated, the disease is treated only by symptom treatment, which is not really related to the specific diagnosis of COVID, but more related to the manifestations of COVID, whether or not you have lung problems, whether or not you're having trouble breathing, whether or not you're getting dehydrated because you can't drink and you have a fever. But there are major benefits of testing for the community. If you can test, you can identify outbreaks where healthcare resources are needed and concentrate those healthcare resources where you know that there's going to be a lot of affected patients. And it also identifies the inpatients, patients who get sick, come into the hospital. We could know if they have COVID-19 or not, so that we know whether or not we should isolate them, and whether or not they need to have all the, as we call the protective, personal protective equipment, PPE, you hear about in the news. We know where we need to use that and where we need to not use it, so that we can save it for the times that we need it. So there's great benefits of testing for the community. But as I remind you, testing for COVID-19 for a particular patient is not as useful, because it is really a symptom-based treatment. Knowing the status of patients who are not sick enough to be hospitalized is not essential. You don't have to know. Somebody's doing well. You don't really need to know if they have COVID-19 for that particular patient, but you would like to know for the rest of the family, the community, and how much to worry about that community having an outbreak. So who are right now the priority groups for testing according to the CDC? As we all know, we've heard, there aren't enough tests to test the entire population of the United States of America. So they have prioritized groups that would be helped if testing were performed, and also groups in which testing helps the community understand better what's going on. So priority 1 patients, who are all, I would say virtually across the United States, all these patients are getting tested. And it's to ensure optimal care options for all hospitalized patients, lessen the risk of infections to people who are in the hospital, who might be able to transmit that to a patient who doesn't have it, and to maintain the integrity of the healthcare system, to make sure that healthcare workers who are symptomatic or have it, they don't expose other people, and people who don't have it can go back and do their work because they have recovered from their common cold. So hospitalized patients and symptomatic health workers are virtually all getting tested in all communities. Priority 2, according to the CDC, is to ensure that those who are at higher risk highest risk for complications of infection are rapidly identified and so appropriately triaged. That just means that if you are at risk for COVID, serious COVID-like illness complications, we'd like to know you have COVID. So we're going to watch you a little more carefully for those signs and symptoms of respiratory problems. So those are the people we talked about: long care facilities, older age, underlying conditions, the older people with heart disease, diabetes, obesity, and also the first responders who have symptoms are also getting tested to see if they have the disease, can they transmit it to other people, what is going on when they are ill. And the third priority group are people who are essential but perhaps not first-line responders, people who don't meet any of the above categories, who have symptoms, healthcare workers, and individuals with mild symptoms in the community who are experiencing high COVID-19 hospitalizations. Again, this is for the benefit of the community. We'll know what's going on in that community. Is that community likely to become a community in 2 or 3 weeks that's going to need a lot of healthcare resources? As you know, we can ramp up. I live in New York City, as Dr. Aldrich does, and we're doing a lot of ramping up in order to be able to anticipate what's going to happen in the next few weeks. So steps to prevent COVID from spreading at home: wash your hands, wash your hands, wash your hands. Soap and water, hand sanitizer, that is the first line of defense, and it's very effective. For caregivers, people who you have, so this is anyone you suspect in your family has COVID or is diagnosed with COVID, you want to make sure you clean and disinfect high-touch surfaces where droplets could fall: tables, chairs, doorknobs, light switches, remotes, handles, desks, toilets, sink. You want to launder items that people have coughed on, including the toys that children might have. Use the warmest water you can. Dirty laundry can be washed with laundry from a person who's not ill, because once you put it in the washer, everything gets washed out. Wear a face mask and use gloves. That's a regular face mask. That's not an N95 if you have a face mask, just so you're not exposed as droplets might come off of the clothes. And if you have a patient or someone you suspect has COVID, or is actually tested positive for COVID, but is staying home because they're not sick enough, you'd like them to use a separate bathroom and a bedroom if possible, just because if they cough, they won't be coughing on other people standing next to them. They should wear a face mask, again, so when they cough, they don't cough the droplets out, and they try very hard not to share household items. So all these are just all practical guides. You cannot follow everyone. You can't do everything as compulsively as 100% to the minute, to the tiniest detail, but as much as you can, try to wash your hands, clean surfaces, and then isolate as much as you can, even though we know in families and parents that's virtually impossible to distance yourself. So just to talk about what the literature is telling us about what happens when you get coronavirus. So 80% of patients who get coronavirus have a mild to moderate illness, which means you don't have to be hospitalized. So the vast majority of patients don't need to come to the hospital, don't need to be admitted, don't need to be evaluated. That means you have a cold, you might have a cough. It's like having a bad cold and a fever, but you feel fine, you're able to drink, and you're just going to lie and wait until it passes over. 15% of the patients have a severe illness and are hospitalized, largely because of problems breathing. They can't breathe and talk at the same time. They're tired and so tired they can't walk around. They get dehydrated. They may have the signs of other problems, such as the kidney problems that can be affected with coronavirus. And 5% of the patients are hospitalized and treated, need actually go to critical care. Those patients are the ones that you hear about in the news. They are very seriously affected by COVID. They have very serious lung failure, much more common in older patients, but still does occur, as we're seeing in children and adults of all ages. But what do we know about children? We know about children from a few publications, all from China. This is the largest series, which is published in our big journal, Pediatrics, just a week and a half ago. So they looked at the 2,143 confirmed or suspected cases in the province of Hubei and around Hubei in China. And they looked at children and they said, okay, children who we thought or we knew had COVID, what happened to them? So if you look, asymptomatic were 4% of the children, and 51% were mild, and 19% were moderate. Now, as I showed you up here, mild to moderate, none of these children need to be put in the hospital for their disease. So the vast majority, 95 or 94.4% of the children who had the disease did not get hospitalized. They were treated at home. 5% of the children, as opposed to This very large number of 20% of the adults, only 5% of the children had to be hospitalized, and most of those, the vast majority, were severe. They were hospitalized, but they didn't need critical care treatment. It was more commonly needed to be hospitalized. About 11 or 10% of the infants need to be hospitalized, and only 3% or 4% of the children who were between 5 and 16 years needed to be hospitalized. So it seems to be a milder disease in children, and we're not quite sure how many children have it, because if they had very mild disease, they didn't actually get tested with the test to see if they had COVID. There are no reports right now in the literature of patients with cardiomyopathy, pediatric patients who've gotten the disease. So what about this news about ACE inhibitors, which many of you have patients with dilated cardiomyopathy will be on, enalapril, lisinopril, or ARB, which is valsartan, losartan. A lot of news about whether or not these drugs affect the heart or don't affect the heart. This is the statement, it's very long, from the Heart Failure Society of America, the American College of Cardiology, and the American Heart Association. And they reviewed all the data, and they came to the conclusion there is no experimental or clinical data demonstrating beneficial or adverse outcomes with background use of an ACE inhibitor, ARB, or other RAS antagonists in COVID-19 or among COVID-19 patients with a history of cardiovascular disease treated with such agents. So the idea is now that do not stop these drugs. They're important for the treatment of the underlying heart disease, and there isn't any data to show that they are beneficial or that they are detrimental to patients who get COVID. And if you get COVID, then there can be changes, because blood pressure can be changed, it can fall. You might stop medications, but again, that's stopping them based on the symptoms of what you're finding in the lab tests, not because of the COVID-19, but because of potential interaction between the side effects of the ACE inhibitors and ARBs and the effects of COVID-19 on the patient. So how do you treat COVID-19? As I told you, no specific treatment exists. There's no well-proven treatment that makes COVID-19 specifically better. So symptoms are based on treatments. Respiratory symptoms are treated with oxygen support, and in very small populations of patients, mechanical ventilation. Heart symptoms are treated with medications to improve heart function. Dehydration with fluids, antibiotics, and other symptoms are treated as they arise. Heart symptoms do happen in patients with COVID-19. The majority of the symptoms happen in that really critically ill group of adults, the 5%. Those patients do seem to have effects of COVID-19 on the heart. It's not clear and does not seem to be that patients with heart disease are more prone to have the effects of COVID-19 be on that heart, so it's separate. COVID-19 does affect the heart. Obviously, if you have an underlying heart problem and you get the effect of COVID-19 on the heart, the myocarditis, that could make a patient sicker, but doesn't seem to make you more prone to getting COVID-19 myocarditis. And as I said, this is rare, except in those patients who are really gravely ill. Medications that are being tested and studied include antiviral agents. There's a medication called remdesivir, which is in clinical trials from the NIH. Anti-inflammatory agents are being used to see if they can suppress what they feel is an inflammatory response to the COVID-19. And recently you've heard about serum from people who've recovered from the infection. All of these are being tested because nothing has been proven, but the testing is going along quite rapidly. So hopefully we'll have some answers in a few months, and even maybe within a month. So if you think you've had COVID or you were diagnosed with COVID, when can self-isolation be stopped? When can these things be said, okay, you've recovered? So symptomatic individuals who are confirmed as having COVID, or those who you decided you weren't tested but you think you did, can discontinue home isolation once they meet the following conditions, according to the CDC. At least 3 days, 72 hours have passed since recovery. That means fever's gone, and without using fever medications, and your breathing has gotten better, and at least 7 days have passed since the symptoms first appeared. So once these things have happened, you don't have to remain on self-isolation. You should still remain on social distancing from other people for all the different reasons that we talked about. So the take-home messages from what I've just told you is that you should practice social distancing and good hand hygiene. If you or your child develops symptoms, call your doctor, self-isolate. Immediately treat yourself as if you have it. Watch for signs of difficulty breathing, blue lips, or extreme fatigue as signs that you have to go to the hospital. We're trying very hard right now to keep you from going to the hospital. Almost all doctors are able to do video visits, which is very reassuring. They can look at you or your child look at how you're breathing, talk about how you're feeling, and it's really very effective for trying to keep people out of the hospital. People only should go to the hospital if they have symptoms that are going to need to be treated. If you don't have symptoms that need to be treated, we're telling people to stay home and take care of yourself and recover from, as you would from any cold that's affecting you with fever and cough. The testing for COVID-19 does help rule the disease. It might not help rule in the disease. And the testing for COVID-19 will depend on your local community. There are communities that are able to test widely, and there are communities that are still limiting the testing to the priority 1 and 2 patients. Your pediatrician or your cardiologist will know what's going on in your community. For the community as a whole, it's nice to know who has it, who doesn't, so we can track what the disease is, how it's spreading across the United States and what the severity is. But for you, if you or your child cannot get testing, do not be concerned. You should treat yourself as if you had it. You should do all the things you should do to make yourself comfortable, to watch for the symptoms. You do not need to be tested for it in order to do what we are telling you all patients to do, as you would do for any child who was sick. You would watch them carefully if they had a fever or trouble breathing or coughing to see whether or not they actually needed medical attention. And the treatment for COVID-19 is symptom-based, but there are clinical trials ongoing. Those clinical trials are really only at the moment for people who need to be admitted to the hospital. That 20% of adults and 5% of children are the ones who are having the testing performed. The other patients who are able to be relatively well at home are not getting testing. So the reference sites for more information, these are some good reference sites to look at. This is the Self-Checker website, American Academy of Pediatrics. And if you're just looking at that statement for the ACE inhibitors and ARBs and COVID-19, this is posted on the American College of Cardiology website. It's also posted quite widely across the web. So that's the end of the formal presentation. Dr. Aldrich and I are happy to answer any questions that you have. So I know it's a great matter of concern for everyone and anxiety. So thank you again to the CCF for allowing me to talk to you about this disease.
Thank you so much, Dr. Shu. We do have some questions, so I'll get us started. And for anyone that still wants to submit a question, go ahead and do so on your question box on your control panel. So the first question, can you comment on if there are any long-term risks known for if a child with cardiomyopathy has COVID and then recovers? Are there any long-term concerns for cardiomyopathy patients?
It's a good question. There do not seem to be any long-term concerns for people who have had COVID. But this disease has only been around since December. So long-term concerns beyond from December till now, there's nothing known. It seems to be for the heart problems, the people who have heart disease and whose heart function is worsened by the myocarditis type picture, they seem to recover once the COVID-19 does recover. So we do know that. Whether there'll be effects 20, 30 years down the road, nobody will ever know until we get down the road that far.
Mm-hmm. Okay, great, thank you. So there's several questions regarding as far as considering children with cardiomyopathy in as a higher risk population. So can you comment a bit on for children with LVNC, dilated cardiomyopathy, hypertrophic, whether they have an ICD or not, whether they're symptomatic or asymptomatic? Are those factors that would impact the disease?
So as I said, they really haven't been reporting children with heart diseases being more ill. None of the reports even mention children with heart diseases, the reports from the children. So that's not at all a sign that COVID-19, that you're more prone to get COVID-19 or complications of COVID-19 when you have these diseases, but we do know they're very rare in the population. And I think these questions are good questions. They're questions that all of us have. I'm curious about this too. When a child with a cardiomyopathy gets COVID-19, what will happen? And I think that it's always hard in a new disease to be able to extrapolate from diseases that are not similar. And it's also difficult for us to give you good advice about what will happen in the future. So one of the reasons this is of interest to me is because the CCF is working on a patient questionnaire to allow families who have children with COVID to report it to the CCF. We've developed a questionnaire that I think Gina and Ashley have been working on Cindy have been working on very seriously to use a Google form to let people submit their own information. So perhaps with what this quote crowdsourcing we have, we might be able to get more information more quickly as families tell us, yes, my child had it, they were at home, or my child had to go in the hospital. We may be able to get information more quickly than we might from the general reports, which are a little more focused on the adults with the disease.
Mm-hmm. Great, thank you. Once you have had COVID-19 and recovered, are you then protected from getting it again and transmitting it to other people?
It's a good question for Dr. Aldrich.
Yes. Can everyone hear me? Thank you guys so much for having me join this panel. So as Dr. Sue has said about many elements of COVID, this is something that we actually don't really know the answer to this. We do think that based on what we understand about SARS, which is a related virus that we've had more experience with 10, 20 years ago, we do think that there is likely immunity. We know people who are exposed to SARS-CoV-2, the virus that causes COVID. We know that people develop antibodies to the virus, and we're pretty sure that those antibodies are protective and that they last at least several months, probably not years and years the way if you had measles or chickenpox, your immunity lasts a lifetime generally. It's probably not going to be immunity that lasts that long. It might be kind of best case, you might have immunity for a year, a few months to a year. But to be very honest, we don't really fully understand the immune system's response to this. And, when you think about it, like, we don't even know what the end point is in China. We know that in China, this has been an epidemic, a pandemic that affected large numbers of people in China. And we know that with social behavior changes that we were able to get things under control, or I should say the Chinese government and people were able to get this disease under control to a large degree. But now we're starting to open up, communication and work environments and things in China, and we still don't know how long lasting is the social behavior change is that going to be. So there's still a lot that we don't really understand about the epidemiology and even sort of the immune response to this virus. I know that in the next 3 to 6 months, we'll all have a much better understanding of that. But it certainly is hard when you are out in the community and, you'd like to know if you've had it that you're protected. That would certainly be, as a parent myself, I would like to know if my child has had coronavirus that, now they're protected. And we don't actually know the answer to that. But we think there is some protection when you have been exposed and infected, to the best of our kind of guessing and based on what we know of similar viruses.
Okay, thank you. Another question is, how reliable is the data from China as it relates to pediatric cardiomyopathy? This person mentions that they have heard that numbers were underreported from China. So to extrapolate the data from China, is that, how does that look for us?
I mean, I'm not sure I can speak specifically to the cardiomyopathy data. I would say, generally speaking, we try not to rely on epidemiologic data from one source because we want to make sure that, it's, across different cultures and geographic areas that it sort of is consistent. So I think from my standpoint as an infectious disease doctor and as somebody who works in epidemiology, I think we tend not to want to rely on kind of one experience and one reporting because that can be limited, regardless of what the, where that is. We want to see that there are trends across places, and everything is really so new that it's hard to know, the data from China versus Italy versus Seattle versus New York. We just don't quite have the view of it all quite yet to, I think, to be able to extrapolate from the data that we do have. So, again, maybe Dr. Su can speak to the cardiomyopathy community in particular, but I would say sort of generally speaking, we like to see data from multiple places and see that there's commonality in order to sort of standardize it.
I think one of the things that you're addressing, but the question is that cardiomyopathy is how much can we know about that in general? I think the reports from China, the report I cited is from a big children's hospital in Wuhan. So I do believe that the doctors there are going to report what they have seen. They did not report the details of the patients in terms of heart disease, but I actually know that if they had a lot of patients with heart disease, they would have said that, but not specifically cardiomyopathy, because cardiomyopathy, as you all know, is a very rare disease. The incidence of cardiomyopathy is 1 per 100,000 children, so that you have to have a lot of affected children to see a lot of affected cardiomyopathy patients. That's one of the reasons we're interested in trying to crowdsource, because we know that there are very few cardiomyopathy patients in many of these places. The likelihood of them getting affected, thank goodness, is not that high, so that we would like to get as much as we can from a small population of patients, a small group of affected patients, which may be patients scattered around the globe. So it's an unknown answer, but I think that what we're seeing is that, especially in the United States, I think what we're going to see is a little bit more, we'll see more patients with chronic diseases in the childhood. We'll see how it's affected, but we won't know those answers for a few months.
Okay, thank you. So we have a handful of questions about daily living kind of considerations. So this one is asking, are there any recommendations that you can share for a healthcare worker who is the parent of a pediatric cardiomyopathy patient?
Yeah, this is a tough one. I get a version of this question I get probably every other day for the last month at least. And it's not easy. I mean, sometimes people even ask me if they should, live separately from their family if they're working in a hospital with coronavirus. I personally do not recommend that. I think that there are measures that you can take. I would think of it as, the best of your ability if you're a healthcare worker, separating, your clothes and shoes and the things that you wear at work in the hospital when you're taking care of patients, finding ways to separate that from your home environment, and think of your home environment as sort of the, virus-free, clean space. A lot of people, if they can, I recommend either you change out of your clothes at work into something else, or as soon as you get home, you have sort of what we call a transitional zone in your house, where it's either a hallway or a garage or some space where you can take off the clothes and the shoes you wore in the hospital when you were caring for patients with this viral illness. And then you can, wash them, bag them up, wash them, and then shower when you get home before you just get into your real home environment. And then doing things like what Dr. Su spoke about in her presentation, simple things like cleaning high-touch surfaces in your home, the light switches, the doorknobs. When we clean our homes, we don't usually necessarily focus on those parts of our house, right? We do the counters, we do the floors, the bathrooms, but you want to also think about parts of your house that you might not usually clean and that you do touch a lot, like those light switches, doorknobs, things like that. And then, bedding, washing your bedding in hot wash, just kind of improving or the frequency or the regularity that you might do a deep clean of your living space, I think can actually go a ways to help cut down on the chance that you're bringing something home and it's getting stuck in the environment. We really don't know how long this virus is viable in the environment. So we do know that it sticks to plastics up to 72 hours. It can be on cardboard for a day or at least several hours. probably can stick to clothes, but it is extremely sensitive to soap and water. So just washing with soap and water actually can degrade the envelope of this virus. And once that's done, it can't replicate, it can't be infective. But we don't really know how long it can stick on surfaces, and then you have contact with it and it can actually cause infection. So we don't really know that yet. So I think if you're a healthcare worker and you're in an environment where there are ill patients with this viral illness, I would just say try to kind of separate your work attire and that kind of thing before you bring it, before you come into your home environment, and think of your home environment as sort of that the best you can, the clean environment. I would say that's probably the most important thing. Don't stay away from your family, because you need joy in your life and you need to be with your kids and they need you. And I think that there are ways to be safe and do your work as a healthcare provider, but also be present in your family life.
Thank you so much. Another question is how to handle groceries and in particular produce, as far as considerations for how to wash produce and that sort of situation with groceries.
I was told that food was going to be a big point of discussion here, and I understand why that would be, right? I think the issue with food in general and produce in particular is that it's not that this is a foodborne illness. If you have an apple, the apple's not going to make you sick unless somebody at the grocery store touched the apple and they had virus on their hands. So the issue is washing things that can be washed with soap and water, if that's possible. So if you have fruits, you can wash them. An apple you can certainly wash with soap and water, or peel it if you're going to eat it. Some things you can't wash with soap and water, so you could probably do some kind of a hot rinse if you can, or if it's fruit that's in a bag, then you could wash the outside, so you're not handling it. I think that just washing the food that can be washed is going to be enough. It's really just that you want to get, if somebody was touching it with their hands and the hands were contaminated, that's where there could be transmission, but not that the food itself is going to be kind of foodborne illness.
And just as a follow-up to that, what about bringing things home like plants and flowers and things that that you touch, but that you wouldn't necessarily wash with soap and water?
Yeah, I mean, anything that you're not, if you bring home a plant and you are handling it and you place it somewhere, then just, get into the habit of washing your hands after. That's something that's come from the outside world. You've touched it and handled it. And then just get into the habit of washing your hands afterwards. And then, you're not going to keep touching the plant necessarily, right? You'll put it somewhere to look at it, but it's not like something you're going to constantly be handling where it could have been touched by somebody with contaminated hands. Some people even think about things like when they're collecting the mail or they're collecting something that packages, things like that. Once you've brought it in, you've unpacked it, before you're going to go and eat or touch your face, you might want to wash your hands, right? Because if it gets on your hands, it's not necessarily the virus isn't going to hurt you unless you get it to your face, right? Unless you touch your mouth or your eyes or you rub your nose, and then it has an opportunity to get into your, get into what we call the mucous membranes, right? In your nose or mouth. So it's more about sort of if you're touching something that somebody else touched and they had contaminated hands, you want to make sure that you're washing your hands. So getting again into the habit, and especially with kids, this is something that, when we're asked to not live the way we normally live and we have to do school from home and work from home and socially distance ourselves, it can be very stressful and it can cause a lot of anxiety, and children feel that as well. So giving kids an opportunity to have some control when they don't have control right now, when most of us don't have control right now, giving kids an opportunity to participate. One of the best things you can do is get kids to get really excited about reminding you to wash your hands. So you can sort of make that their job to say, hey, Mom, did you wash your hands? Dad, did you wash your hands? You know, we just came in from outside, like this is our chore. Or you just went and picked up the mail, let's wash our hands. So allowing kids to kind of become involved in that and to take some control of it can actually do a lot to also relieve sort of some of the stress and anxiety that goes along with all of these social behavior changes.
Great, thank you. Are there any examples of supplements or certain foods that would be good for cardiomyopathy children diagnosed with cardiomyopathy during this time that would help boost their immune systems, such as sea moss or other supplements?
I think I might defer to Dr. Sue for that one.
Dr. Shu, I think you're muted. Hang on one second. Let's see if we can
There you
get
go.
your audio.
Yes. So for children with cardiomyopathy, there really isn't anything that boosts your immune system or makes the cardiomyopathy better. In general, as we know, we would be telling you to do something if anything were to make the cardiomyopathy better in terms of natural food products. And I believe Meg will agree with me that there isn't any evidence that any particular over-the-counter natural food, organic food product helps you fight off COVID more than another. Of course, eating healthy, maintaining the nutrition, keeping people who are ill as nourished as possible is going to help you recover from the illness, but not a specific treatment or a specific kind of food that would say, oh, that'll make you less likely to get the COVID infection. Would you agree, Meg? Is there there's no data for that, right?
Yeah, I would agree. I mean, you know, we are very, you know, not very far into really understanding any medications that can help with this. So I would say, you know, having an understanding of natural products that would be helpful, I would say we are very far from that. So, and I would agree, just adequate sleep, good nutrition, getting some exercise, you know, within the abilities of social distancing and, you know, the other behavior changes we've been asked to do. I think those are kind of the essentials that really will help people to have an immune system that needs to do what it needs to do.
Okay, great. Thank you. There's a few questions here that are asking for your thoughts and comments on considerations for families whose children have received a heart transplant. Any special considerations for them?
You know, I think that for our heart transplant families, just like any of our families who have an immunosuppressive disease, there's a concern that this is going to be a more serious disease in that population. As I said, the data from the adults does not, there were, I think, 4 people with a heart transplant in China out of 90 transplant patients, and 1 was in the hospital with respiratory symptoms and recovered, and 3 were at home. Very similar to the data I showed you for anyone getting a COVID infection, which was a small number of patients, but was somewhat reassuring. We're seeing some patients here, not children, but adults with heart transplants, certainly here at Montefiore. And again, they seem to have the spectrum disease that all adults have. And our one child that has positive COVID-19 is doing quite well at home. So there's, again, very limited data. The pediatric heart transplant community, same thing, is trying to crowdsource their data that we work very closely through the Pediatric Heart Transplant Study Group. That group is now, we have the ability to enter our data into the database that many of our transplant patients participate in a real-time basis. So we're acquiring that data, but right now in the community, there's been almost no reports of children with heart transplants who've had the disease. But the same thing we say for heart transplants is why the heart transplant families certainly know, wash your hands, self-isolate because it's so prevalent in certain communities, do all the things we talked about to try not to get it. If you get it, do the same things we said. Take care of yourself, eat, drink, watch your children, and call your doctors.
Okay, thanks. What is the status on developing a vaccine for COVID-19?
Well, there is a race for a vaccine. I can tell you that much. I mean, multiple countries are working on this. We do have in this country. I know that there are some in early stages, some vaccine trials. I would say sort of the early stages of administering for safety, but really, even the best case scenario. I do not think realistically we would have a vaccine for commercial use for another 18 months, I would say. Maybe 12 months, but I think 18 months is sort of the best case scenario, because you really have to remember that, you know, it's the vaccine to be used by thousands and thousands of people. It really has to be demonstrated to be effective in terms of its ability to create an immune response that does what it needs to do, but it also has to be safe, right? You can't rush that. You know, that takes time, unfortunately, to develop. And despite, you know, tremendous effort and resources put towards this, you know, you can't rush certain things. And I think that all of the reports and the estimates on vaccine development really should indicate that it's, you know, we're at least 18 months away from a vaccine, as far as I understand.
Okay, thanks. Is there any indication at this time that the COVID virus mutates?
It does mutate. There is some data suggestive of that, there's genotypic difference between the strain from Hubei in China and the strain that was isolated in Seattle. So it probably does have ability to mutate, and there might be some slight variation kind of from region to region. And again, that is going back to the question about vaccine, that potentially poses a challenge, because again, we're only, you know, from December till now, 3 or 4 months ago, that this sort of became a part of our lives. And, you know, it's a little hard to know kind of what is our sort of endpoint here in terms of where this virus is going to be able to go in some sense. So I think vaccine development is made more challenging if this is a virus that can mutate. And I don't know that we fully understand the capacity for this virus to do that, right? This is a novel coronavirus, meaning that it has never been in human beings before. So we don't fully understand, like, what is the full capacity of this virus. And I think, you know, that just makes it all the more challenging, you know, in terms of understanding its pathogenicity, how, you know, when can we expect it to kind of burn out naturally, if it's going to do that? What is the capability to create a vaccine? Can it mutate multiple times? I think we don't really know the answers to all of those questions.
Okay, thank you. We have a few minutes left. We do still have some questions, and we will get through a few more as we're able to within the hour. But Dr. Shu and Dr. Aldrich have graciously offered to answer any remaining questions offline. So if your question isn't asked and answered tonight, we will get you the answers from the doctors with their comments in the near future. So I just want to let everybody know, because I know there are still questions coming in. We may not get to all of them tonight, but we will get you an answer. There is another question asking for clarification on the self-isolation guidance. If a patient has a resolution of their symptoms, you had mentioned earlier that they need to be free of any symptoms for 3 days and 7 days from the onset. So can patients come out of isolation at minimum 7 days from the onset of symptoms? Would you clarify that point?
Yeah, so generally this is based on the CDC recommendations, and the recommendation generally is to go with the longer period of time. So some people who get coronavirus, who get COVID, have, a week of fever. That's been, that's fairly common, that people will have fever for 7 days, 8 days. And so we generally will go on the longer period of symptoms. So if somebody only has 2 days of fever, but their symptoms started on a Monday, then we would say you're going to wait 7 days, even though your fever was gone several days ago, right? So it's 7 days from onset of symptoms or 72 hours after resolution of fever without medication like ibuprofen or acetaminophen, whichever period of time is longer. And I want to just be clear, that doesn't mean that if you've had COVID, that you are no longer able to transmit or infect other people, because we actually don't know how long that period is. Some people might have it in their saliva, or it might be found in their poop. And we don't know if that can make people sick or not. We think that it can't. We think that there's a low chance of infecting other people. And we think that people are most likely to get other people sick when they have the fever, when they are actively coughing, when they're really symptomatic. But we don't really know with 100% certainty if that's true. So we generally say for healthcare workers like us, if you've had COVID and you're better, and it's a week after your symptoms, your fever's at least 3 days gone, you can come back to work. You can come to do what you need to do, but we do ask you to wear a mask, a simple surgical mask, because we do have concerns that potentially you could still have some active virus, and obviously we don't want, our nurses or doctors coming back from sick leave and then, not realizing they might get somebody sick. So we generally will continue some kind of precautions for those providers, even beyond when there's symptoms. I think when you're at home, a good rule of thumb is if somebody at home is sick, you're still going to want social distancing, because, you don't really know how long your child might be shedding. So you don't really want to have, a family member come visit who hasn't been sick, and then potentially they can pick it up from the environment at your house or something like that. So I think you can go, you can do what you need to do after a week of illness, as long as you've sort of fulfilled that kind of 7 days or 72 hours. But you still probably want to have some social distancing, because we don't really fully understand if there's a longer period where people could be shedding, or there could be active virus or something like that.
Okay, thanks. For the last question, I'm going to combine a few because we've had multiple questions coming in about medications. And so just as a final thought, I guess, on medications, can you just one more time clarify the use of ACE inhibitors, as well as for treating fevers, is there guidance around ibuprofen versus acetaminophen?
So for the ACE inhibitor question, basically in the news, it's been very confusing. People have said, oh, there's some animal data saying that perhaps ACE inhibition will make you more likely to get COVID. But there's also been some data that in the ill patients, perhaps ACE inhibitors might help you if you have COVID illness. So the data, and neither of that data is very good at all. It's just a little case reports, a couple of patients. So right now, you're taking a medication to help your heart. That's the important disease that you have. You need to keep taking that medication. And there's no indication that you should stop that medication because there's COVID-19 in your community. If you get COVID-19 and if the patient is sick, the child is sick, there could be changes in the kidneys, in the blood pressure that would make us say, well, there's side effects from those ACE inhibitors. We'd like to not have compound the side effects that we're seeing with the COVID, so we may stop the medication. But that will not be because the COVID-19 infection is the problem, but because the side effects of the ACE inhibitor is the problem. So it's really important that people continue to take their medications, because those medications are keeping your child healthy with the cardiomyopathy. For the ibuprofen and the Advil, maybe Dr. Aldrich, you want to give a little final words on that, because there is some confusion on what you should do.
Sure, yeah. I mean, the official recommendation is that you can use ibuprofen or acetaminophen for fever with COVID. There was a very small study from France that looked at use of ibuprofen, and initially there was concern that it might not be the best choice for fever in this illness, but there's not really, the data is not really generalizable, I would say, and I think, you know, many other places have shown that there's no, you know, correlation between ibuprofen use and kind of worse disease. I think, you know, especially in children, if they have high fever, you need, you know, you do want to try to get that fever down, and sometimes you can't just rely on one. You do need to sort of go back and forth between acetaminophen and ibuprofen. So I would say, especially in children, I don't think there's really concern for, you know, in the data that this could be a problem to use ibuprofen. You know, so I would say you should use the antipyretic, the fever medicine that, you know, you are familiar with and that you've used for your child in the past, I think is sort of would be the rule of thumb at this point. Now, what I will say as a final note is, as I have learned in the last month, there can be a recommendation today that next week there's a new recommendation. So I would just say, in general, try to keep an open mind, try to stay informed, try to get the facts, and not necessarily go by, you know, what's on social media. Try to go to, you know, resources like the ones Dr. Sue shared that really are going to give you our best evidence-based recommendations in real time, because this is really a moving target and things are changing. But I will say it is true that, you know, what we've seen in our work in the Bronx is that really we are seeing children with COVID, but they are not experiencing sort of the severe disease that really has been more reported in adults. So, and I think that kind of, from my experience in the past several weeks, it's really going across the board. Kids who are on immunosuppressive therapy or immunocompromised, we just are not seeing the severity of disease that we have seen described in adults. So there might be a little bit of a reassurance there for some of the families who are participating today. But I would say just, you know, try to stay informed with the facts and continue the amazing parenting I think that probably all of you are doing on a daily basis as you work through complicated medical issues.
Thank you so much. Dr. Shu, did you want to share any other final thoughts on the survey before we close out?
No, I would like, I guess, yes, I would like to just say that we are trying to find our way through a disease that is new and a disease that is going to be more and more prevalent across the world. So the one thing we could think of was to involve the families. We know you're the most concerned and the most involved in the caring of children who will be getting this disease. So any information you would like to share with the group would be very helpful. We're hoping to have the survey up within the next week, and I think that we can offer just sort of snapshots of what the survey looks like over the next few months, and it may be very helpful for the community, and ultimately could be actually very helpful in the future as we think about how we approach the disease and how we treated it and what we found out later. And once again, for the families, just to say we're very happy that that you're participating in this, and we understand the anxiety, and Dr. Aldrich and I are here to answer any questions in the future if we can be of any help.
Thank you so much. I just wanted to close us out by thanking Dr. Shu, Dr. Aldrich, both of you so much for sharing your time and your expertise with us tonight. This was a very informative, helpful presentation, and we're very grateful for you taking the time to connect with us this evening. So thank you.
No problem. Thanks so much for having me. Really appreciate it.
Yeah, thank you to the CPF. Thank you, Gina.
Thank you so much. Just a final reminder to everyone on the call. I wanted to show you, this is our CCF Connect online community. So the webinar recording will be posted here, and we also post updates multiple times a week with different resources from places like the CDC and American Heart Association, and credible informative resources for pediatric cardiomyopathy families. So if you're not already on this forum, please feel free to join. You can reach out to Cindy or I, and we're going to email everybody that was on the webinar tonight with this information as well. And we will get any remaining questions that have not yet been answered over to Dr. Shu and Dr. Aldrich for their comments, and we'll follow up with everyone that had remaining questions. So I just wanted to thank everyone again for your time and participation, and we will be in touch soon. Thanks so much, and feel free to feel welcome to reach out to us as well for any questions or anything that CCF can do to support you. Thanks again, everybody. Good night.
Good night.